My name is Sarah McClinney, and I'm in the BSN program at Clarkson. Unfortunately, in the past couple years, I've had a lot of experience with death, both with family and friends, and each circumstance was quite traumatic. I didn't know that these individuals were going to pass away. They were all extremely unexpected. One, my cousin committed suicide, and then a friend passed away unexpectedly. He was a resident at the rehab facility that I work at, and we were extremely close. He was hit by a car and paralyzed from neck down, so he was receiving rehab for that. And then he became extremely ill with a respiratory illness, and this was all during COVID. And he was put on a ventilator and everything. And just with COVID precautions, I was never able to go say goodbye or see him, and that certainly left a great hole in my heart because we were very, very close. And one day I helped him to bed at QLI, and the next day, thinking that he was going to be there, I never saw him again. So just very traumatic. Therefore, I think personally my anxiety with death is a little higher because I've had some very traumatic and unexpected circumstances. I would say probably about a 6 or so. I've also lost 3 of my grandparents. However, all of them went through hospice and everything, so I was able to mentally prepare myself, which I think, not to compare situations because it's hard to compare, but it was a little bit easier when they were going through hospice because I just, again, was able to mentally compared to losing somebody so unexpectedly. Professionally, I've also dealt with death. I have worked in the ER as well as an oncology unit, so I have both helped with postmortem cares as well as been there when somebody did pass, and have been in code situations where a person passes as well. And I think regarding that with healthcare, it's just not very common to take a lot of time after a patient passes. Oftentimes there are there's other patients that need something, so you have to leave that room and go right to the next and just keep moving on. And I think that within our healthcare society, we should normalize just feeling okay to speak up and say, hey, I really need some time. That was really hard for me, or that was really traumatic for me, and I just am not ready to help another patient at this moment. Could you help them while I take some time? I think that should just be normalized. I was able to relate a little bit with Amanda in her podcast when she mentioned wanting to keep her husband alive for as long as possible, which certainly in that circumstance made sense. However, I think just in some circumstances, if a patient is terminally ill and in great pain and suffering, it should be more granting the wishes of that patient. If they're suffering so greatly, we shouldn't want to keep them around for ourselves because we want them here. I think it's more important to respect that person's wishes, which reminded me a little bit of the situation with the QLI resident that passed. He, of course, was obviously very depressed, being paralyzed, and likely never going to be able to walk again. He was young, an athlete, and so his injury was absolutely devastating to him. And during the time when he was sick, of course, I wanted him to get better and everything, and it was looking as though if he were to be able to leave the hospital, he was going to be on a ventilator for the rest of his life, which certainly is nothing that he would have wanted. He was already suffering so greatly with his injury that additional setback of not being able to breathe on his own ever again was going to be more traumatic for him. So just, again, recognizing that this isn't something that he would want. So it's selfish to want to keep him around, and as much as I wish he was still here today, just normalizing that sometimes in some circumstances, death might just be the better alternative, because I know that he's at peace, and he certainly was not at peace when he was still alive. So I think throughout this class, my goal is to just really understand the stages of grief, because I didn't necessarily go through them with The last two deaths that occurred in my life, because it was just so unexpected and fast. I just wanted to brush it under the rug kind of and move on about my life and not think about it too much because it was just so devastating. So just really learning about the stages of grief is one of my biggest goals. So yeah.